All right, I just want to make sure you can see the screen pretty well.
Yes, I can.
Okay, perfect. So, all right, well, welcome to the first webinar in the American Lipedema Association's DIY Lipedema Therapist series. So, this series was created to help patients better understand some of the conservative therapies used to manage lipedema. And the reality is that there are just not enough providers, and many women do not have access to a knowledgeable therapist in their area. So, the goal of this series is to give you practical information so you can better support your own care while you work to find providers who actually understand lipedema. My name is Bailey Maddox Rottenberry, and I am a licensed massage therapist and certified lymphedema therapist. And much of my clinical work focuses on lipedema. That said, I am not your therapist, and the hour we're going to spend together does not replace medical care. I am not here to diagnose or provide individual treatment advice. My role is simply to help provide information that can help you make more informed decisions as you navigate your lipedema journey. Because until you're able to work with a knowledgeable provider, the most important person supporting your care is you. So, in addition to my clinical work, I do work for a DME that specializes in compression products and pneumatic compression pumps. So, a little bit of background, I have been a licensed massage therapist for nearly 10 years, and that's what led me to become a certified lymphedema therapist. And this webinar has actually been in the back of my mind for the last year because one of the things that just kept coming up with conversations with patients was that the reality is that many women simply don't have access to a trained therapist. And when that happens, many patients end up doing the best they can to become their own therapist. That need, combined with the feedback from ALA members, was what brought this series to life. Each webinar in the series is going to focus on one of the most common topics that patients ask about, including compression, preparing for appointments and how to interview providers, conservative therapies used in lipedema care, and then the therapies that help you prepare for and recover after lipedema reduction surgery. And today we're starting with compression because it's one of the most accessible tools you can have to manage your lipedema. And we're going to break this topic of compression down into four main parts. So, first, we're going to give some context as to why compression is important in lipedema care. And then the main focus of today's talk is going to be about compression wearables. And then we'll also spend some time discussing pneumatic compression pumps because they can be really great support tools. And then the most exciting part is how to choose your compression so that by the end of this webinar, you should have a better understanding of how compression works and then how to choose options that may work best for you. There's going to be a few terms that are going to come up repeatedly, so feel free to take a photo or a screenshot of this slide so you can reference it as we're going through. So, compression is measured in millimeters of mercury, or mmHg. Compression class is the strength of a compression garment, again, measured in mmHg. And containment is how well a garment resists stretching when the tissue starts to push against the garment. Higher containment helps to stabilize that soft tissue and helps manage swelling. We have circular knit, which is often ready to wear garments that stretch easily, and then flat knit, which are often made to measure garments that provide more containment. And we're going to zoom out for a second, so just talk about where compression actually fits into the lipedema care. So this graphic created by the Lipedema Foundation shows just how many therapies are being discussed and explored. And compression is usually talked about within the larger category of conservative therapies for lipedema. Conservative therapies are treatments that aim to manage symptoms without surgery. And there are a lot of things to try, but the ones I'm going to highlight are the therapies that physicians and insurance companies are looking for you to try, especially when you are considering lipedema reduction surgery or applying for a pneumatic compression pump. So those typically include therapies like exercise, limb elevation, manual lymphatic drainage, dietary approaches, and compression. And unfortunately, there is no magic one option fits everyone when it comes to compression. So understanding how compression actually works is going to make it easier to understand why certain garments are recommended and how to choose the options that work best for you. So we're going to do like a little bit of a game, fact or fiction. So you can give me a thumbs up or a thumbs down if you think this is a fact, or thumbs down if you think it's a fiction. Compression doesn't help because I don't have lymphedema. Okay. Yeah. So we've got a consensus of thumbs down. It is fiction because compression has a lot of benefits. Even people who are perfectly healthy with lymphatic systems still benefit from compression. Compression helps to support that soft tissue. So if you have cuffing or lobes, places where that skin starts to hang over a joint, the correct compression can actually lift the tissue and support it, not only taking pressure off the skin, but also reducing inflammation. So inside the body, there is always pressure pushing outward to the skin. And it's illustrated here by those purple arrows. So this pressure comes from several sources. Blood moving through the capillaries, fluid moving through the tissues, just the natural pressure that exists inside the soft tissues. And in lipedema, the tissue often contains more interstitial fluid, and that can overload the lymphatic system and increase strain trying to manage that fluid. As the fluid accumulates, the pressure inside increases against the tissues. So imagine a balloon filling with water. As it fills with water, the pressure inside increases and that balloon expands outward. The tissues in the body behave a very similar way. When the fluid accumulates in your tissues, the pressure inside pushes outward towards the skin. And then compression garments work by applying pressure from the outside. Those darker purple arrows represent that external pressure from the garment. And earlier, when we were talking about how the tissues already have pressure pushing outward towards the skin, well, when compression is added, it provides a gentle counter pressure pushing inward. And this helps to balance the pressures acting on the tissue. And when that balance improves, it can limit how much fluid accumulation in the tissues, and it can help support the movement of fluid back into circulation. And because of this, compression and decongestive therapies like manual lymphatic drainage can actually reduce swelling. And when swelling decreases, you notice less heaviness and less pain. And sometimes we can actually see a decrease in limb circumference. And that size change is not because the lipedema tissue has disappeared, but because the fluid surrounding the tissue has decreased. And many women with lipedema also have other conditions that contribute to swelling. This might include venous insufficiency, inflammatory conditions, or simply just long periods of standing or sitting during the day. Compression can help manage swelling from all of those causes as well. All right, so thumbs up or thumbs down. I don't have to wear compression every day. Okay, mixed reviews. It is a fact. Compression therapy is better than no compression, but it doesn't always have to be in garments. So most compression garments are about a 15 to 40 millimeters of mercury. Custom garments do rarely go over 50, but they can go much higher. So roughly every foot of water that you are immersed in, you experience about 22 millimeters of mercury. So if you're waist deep, about 3 feet in water, you're getting 67 mmHg. That is more than most of those standard garments, and you didn't have to struggle to get that compression on. And this is one of the reasons that people notice their legs feel lighter and less swollen after spending time in the water. The water provides natural compression. So if you spend most of the day at the beach or in the pool, you're going to get more compression than most standard garments. Plus, if you make a pool outing a family event, you get that family support as well. And then therapy becomes a team activity. And this is also a really good place to talk about something that often comes up in my practice, where we focus on consistency over perfection, especially when it comes to compression. So real life happens. There's going to be days where you just don't want to wear your compression. There's going to be days that it's hot outside, you're on vacation, you just don't want to think about your lipedema. And that's absolutely normal. The goal with compression is not perfection, it is to be consistent over time. And so if you're going to go somewhere and you've decided not to wear your compression, simply take it with you. So this way, if you decide that you want it later, you have that option. And then if you want some compression, you still have that flexibility. And also, some garments have more containment than others. So, garments that have really strong containment, they're going to feel a little bit thicker and they're going to feel a lot firmer. Garments with less compression are going to be lighter and a little bit more breathable. So, some of the lighter circular knit garments feel almost like really cheap pantyhose. They're really thin, they're very stretchy, they provide less containment, but they have the same level of compression as some other garments. And the best way to kind of understand this is to think about two compression socks with the exact same compression level. We can say like a 20 to 30 because that's a pretty normal range. And we can look at two different brands. If you drop a bag of marbles into one sock and then this another bag into the other sock, you're going to see that one sock might stretch a lot more than the other. That's very normal. That is the difference between containment between those two different products. So for days when you're wearing regular compression and you feel like you can handle more, you can wear something with a higher containment. On days that you're just like, I don't want to wear my compression, you can wear an option that has less containment because some compression is still better than none. But it is really about finding the balance that works for your lifestyle. Aim for consistency over time versus feeling like you have to be perfect with your compression every day. All right, so fact or fiction? I have a pump, I don't need a garment. Okay, we got some thumbs down. So, fiction. Pumps are excellent support tools, but they do not replace the need for garments. So, these devices use chambers that inflate sequentially, applying pressure to the limb and helping to move fluid out of the area. And it doesn't matter how many chambers your pump has or what the brand is. Compression pumps work on the same principle of creating significant pressure to move fluid. And this is why your legs feel lighter after pumping. The fluid is being squeezed out of the limb. So both pumps and garments apply that counter pressure. Typical pump use recommendations are once or twice a day for an hour each time. Compression garments, on the other hand, are often worn for many hours throughout the day, usually 8 hours, sometimes longer. And because of that difference in time, pumps and garments play very different roles in swelling management. A pump that has more fluid, or a pump helps to move more fluid out of the tissues during that treatment session. Compression garments help prevent fluid from rebuilding back in that area throughout the day. So the two tools are not really replacements for each other, but they're more like partners. The pump helps to reduce the swelling, and then the garment helps to maintain the reduction once you're up and moving again. And gravity matters. When you're laying down using your pump, gravity is not pulling fluid down towards your feet. But once you stand up again, gravity starts working against you. Those garments help counter that gravitational pressure. And during the day, when we're standing, sitting, walking, we're experiencing gravity. So these forces can contribute to fluid reaccumulating in the lower body, pushing those light purple arrows back out towards the skin. And without a proper compression garment providing the counter pressure, the internal pressure begins to build again without any restrictions during the rest of the day when you're not using your pump. So a pump provides intermittent compression, garments provide continuous compression. Both have value, but they serve very different purposes. All right, so fact or fiction? Compression is painful. Okay. So, fiction, compression garments should not be painful. When compression is fitted correctly, it should feel supportive. It should feel like a hug. It should not feel restrictive and it should not cause pain. If the compression you're wearing is causing welts or blisters, numbness, or significant discomfort, that means the garment is not the right fit for you. And there is a very big difference between pain and discomfort. Compression can feel different when you first start wearing it. Your body may need some time to adjust to that sensation, but pain is not something you should have to push through. Pain is a sign that something about that garment is not right. And finding that right garment does take some experimenting. And like any good experiment, there are variables that you can change without having to give up on the entire process. You can play with compression class, going for more compression or less. The style of garment, is it difficult to pull on waist-high compression? Because you can opt for knee-high socks with bike short style compression. Fabric also makes a huge difference. Some have texture for like a micro massage element, and some are smooth. And one of my favorites actually has holes in it to allow for more airflow. There are a lot of different fabric technologies to try. And then there's circular knit versus flat knit. So circular knit are going to be a little bit thinner. There's going to be less containment. So if you're in a stage 1 or stage 2, or you want to try wearing something that feels more like regular fashion pantyhose, circular knit can be a really good option. And if you're picking fabric out from behind your knees constantly or around your ankles, that's a sign you need more containment. And that's what you find with flat knit. And this is also why I usually recommend that patients start ordering with just a couple of garments. So instead of ordering several pairs at once, start with just one or two and see how they feel. Wear them during your normal daily activities and pay attention to how your body responds. Once you find something that does work well for you, then it makes sense to invest in additional garments. General rule of thumb is that you need to wear and wash a garment 5 times before saying this is not the garment for you. And every time you put the garment on your body, that counts as a wear, and then you need to wash it. Compression garments are like underwear. You wear it once, you wash it once. And the same thing actually still goes for custom garments. Custom garments are great for a lot of reasons, but they are very expensive, especially if you do not have insurance coverage. So even if you're going the custom route, order one pair, see how it fits, and then in 30 days, you can order more. So when you think of compression wearables, you probably think garments, but there are other options. We have two main types of wearables. We have adjustable systems and fixed systems. Adjustable systems are designed to adjust as you change. And this is for when you're having significant swelling, like after lipedema reduction surgery, or if you also have lymphedema. These are used in decongestive therapies. Now, they are cheaper than compression garments, but they don't have the same life expectancy. They last for about 3 months before they need to be replaced. They apply that counter pressure that we've been talking about. But because the limb is changing so quickly, the compression system needs to be adjusted throughout the day. As these systems do their job of moving fluid and making it harder for fluid to reaccumulate, that limb is going to get smaller. And this facilitates the need for the wraps to be downsized. A lot of Velcro wraps actually allow for about a 20% reduction in limb volume before they need to be replaced for a smaller size. And some brands of Velcro compression wraps are designed to be trimmed, so as the limb gets smaller, you don't have to buy new garments within that 3-month window until they wear out. And Velcro systems can also be used if you have difficulty donning traditional compression garments. They are bulkier than regular garments, but they are a fantastic option that's often overlooked. Now, most medical compression garments are going to be what I called fixed systems. This means that the garment is designed to provide a very specific level of compression based on the size of the limb at the time that it was measured. Unlike adjustable compression wraps, these garments do not adapt to your limb when it changes. There's a little bit of leeway, but generally speaking, it's not going to adapt. So if your limb becomes smaller because swelling has improved, that garment is going to become loose. And when that happens, the garment is no longer providing the same level of compression it was originally designed to deliver, which puts us back into this situation. So this is why garments need to be measured when the limb size is relatively stable. If someone is actively reducing swelling through therapy or lifestyle changes, that limb size may change fairly quickly. And if we order circular knit that is basically off the rack, we can get those garments fairly quickly, usually within 2 weeks, if not sooner. Flat knit or custom can take several weeks, sometimes as many as 12 weeks. And during this time, if that limb changes, the garment may not fit when it arrives. So it makes sense to wait until your limb size is stabilized before ordering multiple garments. So, fixed compression garments come in different compression classes. Manufacturers do vary slightly in their exact ranges, but they roughly fall in the same classes. Your class 1 compression is your lightest level. These garments provide very gentle support. We have class 2 that provides a little bit more support and is still fairly easy to get on. Class 3 provides that firmer support, and at this level, garments are going to be noticeably tighter and it's going to take a little bit more effort to get into it. This is when donning aids become your best friend. And this is where you can find garments both in circular knit and flat knit garments. The choice between circular knit and flat knit in class 3 comes down to the amount of containment that is needed, not just the compression class itself. And then compression class 4 is going to be that strongest level of wearable garments. The body can tolerate much higher compression levels. We've seen as high as 120 millimeters of mercury, but that is very difficult to try to get on. So when it comes to these higher levels of compression, we have to look at some other options as well, just to make it easier to put on. And that's why typically these custom garments do top out in that 50 to 60 range. And another factor that can influence compression strength is decision is the vein health. Venous disease also has its own stages. And at the lower levels where there's minimal visible vein disease, we can go with a lower compression class. As the stages progress, we might develop varicose veins, swelling, skin changes, sometimes even ulcers. Those conditions do better with higher grades of compression. So when the venous disease is present alongside lipedema, we actually have to take that into consideration because those veins need additional support to help the blood move back towards the heart. And these are the starting ranges for compression classes, taking venous health into consideration. Again, more compression is beneficial as long as it's tolerated. You're going to need to understand graduated compression. Graduated compression means that the pressure is not the same throughout the entire garment. So compression manufacturers like to talk about giraffes because they are excellent examples of graduated compression. A giraffe's heart is several feet above the ground. Gravity should be pulling that fluid down towards their lower legs all day. And if we had that same anatomy, we would probably have swollen ankles. Giraffes don't have swollen ankles. So the skin and tissue in a giraffe's legs are extremely compressive and they have a very high level of containment. And this acts as a natural compression garment. This provides compression around that lower leg to help the fluid from pooling. The pressure is stronger in the lower leg and then gradually decreases as you move upward. Medical compressions are designed with that exact same concept. Graduated compression means that it's going to be strongest at the foot or the ankle and gradually decrease as you move up the body. That pressure gradient helps to support the movement of fluid back towards the body instead of allowing it to pool in the lower leg. Now, circular knit versus flat knit refers to how the compression fabric is actually manufactured, and the construction changes how the garment behaves on your body. So circular knit garments are made on a circular knitting machine, which produces a seamless tube of fabric. Because of the way that fabric is knitted, circular garments tend to be more elastic, lighter, and breathable. Many circular knit garments are ready to wear, meaning they come in standard sizes and are often purchased just off the shelf. This is why if you don't fit into one brand size chart, look at different brands. You can even do some custom circular knit as well, and those do tend to be cheaper than custom flat knit. But again, we don't have the same containment. Flat knit garments are made differently. The fabric is knitted on a flat panel and then sewn together, and it creates a seam. Because of that construction, flat knit fabrics tend to be stiffer and less stretchy, which is why it has more structure and more containment. Flat knit garments are often custom made and they can match the exact shape of your limb precisely. The biggest factor influencing containment is the knit construction, which is why flat knit and circular knit behave so differently. But containment is also influenced by a couple of other factors. The thickness and type of yarn that is used with that garment can create stiffness. The density of the fabric, meaning how tightly those stitches are knitted, also affects containment. And then finally, garment design features such as seams, reinforcement panels, or padding increase the structural support of that garment. All of these elements work together to determine how much that fabric resists stretching. So, circular knit compression behaves more like leggings. That fabric is stretchy, it's flexible, it moves easily with your body. Flat knit compression behaves more like jeans. The fabric is thicker, it has structure, and it holds things in place. And that structure creates that containment. For lipedema tissue, which may be soft and compressible, the extra containment from flat garments help to better support that swelling and tissue. And the combination of correct compression class and containment can make it really difficult to get those garments on. This is where donning aids come in. This is also where innovation is really starting to shine. So the Magnite on the left, that green contraption, it has magnets in it so that you can use it for both open-toed and closed-toed garments. For open-toe, that silky donning aid sleeves like the black lipo slide in the middle, or even plastic trash bags work to reduce the friction between the fabric and the skin to allow it to be a little bit easier to slide on. And then you've got donning butlers like the Medi Butler on the right that hold the garment open for you to be able to push yourself into. Sometimes these come with your compression garments and sometimes you order them separately. If you are billing insurance for your garments, these are billed as accessories. You can also use rubber gardening gloves or kitchen gloves. They give you really good grip on that fabric to be able to pinch and pull. And you can also try putting on your compression first thing in the morning because this is before fluid really has a chance to reaccumulate. And that's all for daytime garments. Nighttime is way more simple. Compression garments are generally designed for two situations, daytime use and nighttime use. Daytime use is intended for when you are upright and moving throughout the day. These garments are typically thinner and designed with that graduated compression. Nighttime, though, you're laying down. Gravity isn't pulling fluid towards your feet in that same way, so the goal shifts. And instead of creating a pressure gradient, nighttime garments focus more on tissue containment and maintaining that swelling reduction that you've achieved during the day. That's why nighttime garments are often made with thicker materials and provide structure and support rather than elastic compression. And most nighttime garments do contain foam or textured material. They can be really good for breaking down fibrotic areas. Nighttime garments also often have Velcro or a way to cinch it down so that you don't need those donning aids. And nighttime garments tend to look very different from their daytime counterparts. So most compression brands have both daytime and nighttime options. This example is by Jopes. It's the same style of arm compression. You can see where it goes from the armpit all the way down to the palm. The daytime is very thin and that nighttime is thicker and it has large foam channels. Many insurance plans that cover compression garments will provide typically 3 daytime garments every 6 months for a lymphedema diagnosis, 1 to wear, 1 to wash, and 1 for a backup. For nighttime, coverage is a lot more limited. Most plans only cover 1 nighttime garment per year, again, for a lymphedema diagnosis. Because of these limits, you need to think strategically about when you order your garments and how you use your coverage, especially if you're noticing large fluctuations in limb size. But regardless of what type of garment you have, whether it's circular knit or flat knit, compression class 1 or 3, daytime, nighttime, the way that you care for all of these garments is the exact same. It is according to the manufacturer's recommendations for that garment. So some garments are designed to be machine dry, some are designed to lay flat to dry. As fabric technologies change, so do those care instructions. And the manufacturers have spent a lot of money on R&D to try to bring the best product to the market. But general rules, no bleach, no fabric softener, and follow the tag. All right, so pumps. When it comes to pneumatic compression pumps, one of the most important things I want you to understand is that this is a long-term medical device. Most insurance will only replace a pump about once every 5 years. Even if you change insurance providers, it's still one pump every 5 years. Because of that, it is important for you not to feel like you have to choose a pump specifically because that is the brand a provider has suggested. If your therapist or doctor has recommended a pump, it's probably one that they are familiar with, but you are the one who's going to be using this device regularly, hopefully daily, for years. So it is worth taking time to actually understand the features and decide which is actually going to work best for you for your lifestyle. And one way that I actually explain this to my patients is to think about when you buy a car. If your friend tells you to buy a certain car, you're probably not going to just buy it based off of her word. You're going to look at it first. You're going to compare features. You're going to think about how you like to use your vehicle, and you might even test drive a couple. Choosing a pump is no different. This is the device you're going to use on a routine basis in your home, and it should fit into your daily routine as easily as possible. And there are several lifestyle factors that can make a big difference when you're choosing a pump. For example, do you have pets or young children around? Because you might want to consider one that's going to be very easy to clean. If you travel frequently, portability might be important because some of these pumps are a lot easier to travel with than others. And small design features also matter. If the sleeves have zippers, can you pull those zippers? Do you have hand or joint pain that makes it difficult to set up that pump on a routinely basis? Is the pant system 3 parts, or is it one piece that you can easily get into? Some pumps allow you to easily adjust the pressure settings or even choose different treatment programs. Some allow you to skip certain areas. So if your knees are really bothering you that day, you could skip that section and still pump the rest of your legs. Some pumps also connect to smartphone apps, which can track your treatment sessions or adjust the settings. And these might seem like really small details, but when you're the one that's using that device, it makes a really big impact on how easily it fits into your routine and how consistently you can use it. And another important factor to think about is customer service. Most insurance plans will only cover that new pump once every 5 years. And if the pump that you receive has a 1 year warranty and it breaks after 2 years, you're going to be responsible for the repair cost or be without a pump. So it's worth asking about a warranty period and what happens if something needs a repair. Customer service also really matters because these are investment pieces. If you need help troubleshooting that device, how easily is it to reach somebody? And these are questions that make a really big difference over time. You have EO651 pumps. These are your basic pumps. The sleeves that attach to the pumps just cover the legs or the arms, like wearable compression, like up to the armpit or a thigh high. They tend to have less chambers or segments, and they fill air to move that fluid. And these pumps do not cover the torso. And we have EO652s. These are your advanced pumps. These are the pumps that comes with those bells and whistles. The pressure and time can be more easily adjusted. The pumps also come with pants that cover the abdomen or a jacket that covers that chest wall part of that torso. And this helps to move fluid out of the limb and also direct that fluid where it can actually be processed. These pumps also tend to have more chambers. And when we're talking about chambers, chambers are the segments of that pump sleeve that fill with air to push the fluid into that next segment. When that next segment fills with air, it's going to push fluid to the next area. And manufacturers say that more chambers is better. The best number of chambers is on the pump that you're going to use consistently. For lipedema, the advanced pumps, those E0652 pumps, do better because they provide compression through the entire limb and into the torso. The pant system provides compression throughout those hips and the abdomen, and this decreases abdominal edema. For most of my patients, when I know their full medical history, we usually do an advanced pump recommendation, but the exact brand comes down to their lifestyle. And that's not to say that a basic pump has no benefit. It is still providing compression. And if you have other things going on, like you have a colostomy bag, you may not want to put compression over your abdomen. And if you have extreme difficulty with zippers and Velcro, you may still benefit from a compression pump that with a sleeve that has none. So Medi is one of our manufacturers that has a really unique design for their sleeve. It is a giant sack. There are no zippers, no Velcro. You just slide into it and it pre-fills with air to measure your limb before it starts going through the compression cycles. But the drawback is that you cannot really easily adjust the pressure the same way that you can with other pumps. But again, this is why you should have a choice in what pump you invest in, because you have to make sure it meets your needs because you're going to be with it for several years. All right. So everything about how you manage lipedema is your choice. You get to decide which therapies work for you and which therapies are worth your time and your effort. So let's actually get into the meat and potatoes of this about how to choose your compression. So I want you to start asking yourself some really important questions because there isn't one garment that just fits everybody. The best compression garment is the one that supports your tissue and is realistic for you to wear consistently. And here's some questions that are going to help you guide that decision. And we're going to do this kind of a quick fire. So start thinking about those questions and we'll go from here. Do you need an adjustable system or a fixed system? Because if you need adjustable, this is the end of your decision tree because you know that you'll need a Velcro system if you're donning the compression yourself. Or you can opt for short stretch bandages if you have someone skilled who can help you apply them. But if you need a fixed system, we are still going to be answering some questions. Based on your stage of lipedema and any venous issues, what compression class do you need to start with? How much containment do you need? If it's under 30 to 40 millimeters of mercury, you may not need a lot of containment. If you need more than 30 to 40, you're going to need more containment. So less containment leaves circular knit on the table as an option. More containment means flat knit. And if you need circular knit, you can measure at home and look at the options online and order the exact one that you want. If you need flat knit, find a professional fitter because each brand measures very differently. Professional fitters are actually trained to do this. We go to workshops to make sure that we are staying up to date with how that manufacturer likes their custom flat knits to be measured. And also, a professional fitter knows how to place those orders and help you through that process. Now, based on your fabric type and compression class, is it going to be easy for you to wear one piece or do you need to break it into multiple pieces? So if you have difficulty pulling things up all the way up to your waist, you can look at doing knee highs with that bike short compression style. You're breaking that piece up into multiple pieces. And then what does your mobility and grip strength look like? What type of aid do you need to put that garment on? Do you need to consider a Velcro wrap compression system to make it easier for your hands? And that's it. Those are the questions that a therapist would answer to be able to pair you with the right garment to start with. And I really do mean start with, because you have to wear and wash that garment 5 times before we know if it's the right fit for you or not. You need to treat this like a science experiment. We have to make adjustments, try different brands, and sometimes even try different compression levels. But it does feel a little unfair to kind of lead you all this way and then just let you be out on your own. So, little short bonus segment on about how to actually order the compression. Ordering, I promise, is the easiest part of this entire journey. You have 2 options. You have order compression wearables yourself or through a DME. If you're ordering it yourself, there are websites out there so you can see literally all of your options. They have everything and so like all of the different brands, all of the different styles, the different containment, it is all available online. And some of these websites even have options where they can try to bill insurance on your behalf. You can also go the DME route. DMEs are durable medical equipment suppliers. They are businesses that order your compression products for you. Now, not every DME specializes in compression therapy, so working with one that has experience with lymphatic conditions can make that process much smoother because they can pull from their experience and you're doing a little bit less experimenting on your own. And the really good thing about DMEs is that they are not as hard to find as a lipedema therapist. You can call your local cancer center or vascular centers because they have patients that need compression. Now, they may not be familiar with lipedema, but you are. And you are capable of making educated choices about your compression needs. You just need a personal shopper. And that's it. So if there are questions, I'm happy to take them. I'm also going to put up my contact information, and we can go from there. I know that was a lot of information in 40 minutes.
Thank you, Bailey. That was great. If anybody has any questions and you're not able to mute, raise your hand so I can see you and unmute you. Or you can put them in the chat box. I know we also have board member Karina here, and she'll keep an eye on that for us as well. And Francine is here. Got a couple board members. And I'm Jenny.
Hey,
It says American Lipedema. Go ahead.
I'm Karina, and this is Piper because she's missed me all day. So, hi, everybody.
Hey, how's it going?
So, question for you, Bailey. I know we're starting to get some in the chat, hopefully. And I know you talked about the compression being great in water, even if it's only 3 feet of water. What about people with hot tubs? Are like a hot tub contraindicated for people with lipedema/lymphedema?
So that's a really good question, and it kind of comes down to what else are you experiencing? There were some recent studies at the Boston Lymphatic Symposium that showed basically heat increases the sodium that is excreted from the lipedema tissue. And we basically know, like kind of paraphrasing it down, is that when you have a lot of salt floating around in your body, that leads to dehydration. That can impact your lymphatic flow, it can impact your blood flow, it can ultimately impact even like your oxygen levels and blood pressure. So while that heat can be really relaxing, it's going to be up to each individual person if a hot tub is better or not. But the water itself, just 1 foot is like 22 milligrams of mercury right there. Sorry, millimeters of mercury. And that's a lot.
So, maybe just a lukewarm hot tub then.
Yeah, but if you love the heat, be in the heat. It also comes out, and this is where like I always talk about like the balance because very few people have the exact same lipedema symptoms as somebody else. Because if we look at lipedema being a syndrome with a lot of other things in the basket, we can't have a stock answer for each person because every person has a different basket.
So, we did have a request if you could put up the contact slide again, if you wouldn't mind sharing that.
Let me make sure. Okay, is that up? Oh, try that. Is that up?
There we go. There you go, Kathy.
Yeah, and that is my cell phone. So if you have questions, even at 3 o'clock in the morning, I always tell my patients, text me. I may not respond at 3 o'clock in the morning, but it is not going to bother me and I will check it eventually. It may take me a day or two. And I wasn't sure if there were other questions in the chat box or not. Now that I have the screen up, I cannot check the chat.
I don't see any other questions so far.
I don't either.
Okay, I wasn't sure if there was something further up while we were presenting.
No, I didn't see anything back there. It was kind of going down his history lane for me back to when I was first diagnosed and was getting CDT and using Velcro wraps during that time, and then switching over and getting custom lower leg and then having off the rack compression for my whole leg on top of it. Yeah, it's been a real journey over the years. And over the years, I've had to be remeasured for those custom garments. As time goes by, your body changes. And I've had to be remeasured about 4 times in 6 years.
Yeah, so the really interesting thing about measuring is we're finding if you are consistent with the therapies that manage your inflammation, we can see a decrease in that limb volume. And especially with the rise of GLP-1s, we're also seeing a decrease in overall circumference. So you do have to get measured frequently for it. We normally do a remeasure every 6 months because of how much that changes. Also, 6 months is about the time that your next set of garments comes out. Also, though, on that note, is that if you're not really wearing compression at all and you start wearing compression, we see really significant changes in that first 30 to 45 days. And that's one of the reasons I also say only order one to start, because most manufacturers, when it comes to the custom, if it no longer fits in that first 30 to 45 days, again, depending on the manufacturer, they will do a remake for free. So if we use that first 30 to 45 days as a decongestive period to move fluid in one garment, we get it remade, and then that's only one of your three for that 6 months. Then we can order two more in your new size. And the 6 month mark starts when you receive the first set of those garments, if that makes sense.
Yep.
Okay.
Yeah, and it was very interesting when I was first fitted for the custom legs. The first pair came through completely wrong, and my therapist had measured me and had been trained to measure me, but my legs were so unique with the lipedema that they had to have a fitter from the company come out and measure me. And that's the way I've done it ever since, is go right to the horse's mouth because my legs are different.
No, and it's always good to go to the horse's mouth. And if you're in an area like a larger city, these companies will actually bring in specialists to do a measurement and to do a training. And if you're on their like list, they can call you and say, "Hey, we don't work with a lot of lipedema women. We would like to. We would like to train our therapist on how to work with you. Would you mind coming in and being our model?"
Hmm.
Because that actually makes a big difference because again, these fabric technologies are changing so much, so the way that we have to measure changes. And there are some different tricks in the trade, like if you've got a little bit larger of a lobe or if you have an area that's really soft, we can either measure you while your legs are like stretched out on like a couch type setting or wrap you in saran wrap to help lift that tissue to get a more accurate measurement.
Interesting. Great. Yeah, and I see Francine has mentioned in the chat that she uses a combination of DME and do-it-yourself compression. Which yeah, I think a lot of us probably do a combo.
Mhm.
Yeah.
Yeah, and for the most part, you don't necessarily need a true DME unless you're looking at the custom or flat knit when it comes to the measurements. Because circular knit is pretty standard. If you literally follow that manufacturer's chart and then you fit yourself into that size range. Out of pocket, those tend to be a lot cheaper. When it comes to flat knit, you really want somebody who's trained in this to measure you. One, because if they get it wrong, they have a direct line to get that correct. But also, fitters, we lose our ability to measure for that company if we have too many mess ups.
Ah,
That's
I
really
mean,
interesting.
good to know.
yeah, there is a little bit of a learning curve, but if I'm measuring garments, because again, these are garments are very expensive to make, and co-pays are also kind of pricey. So it's hard to have to justify constantly remaking it because of human error. So if we are the human that is making that error on a regular basis, corporate is going to come down to us and say, "You're not doing this anymore." And so where I go back to also professional fitters are also a lot easier to find because you can go to a vascular center, you can go to an oncology center and just ask, who does your fittings? I want to work with a certified fitter, not just a sales rep. You want to work with a certified fitter. And if you know that there's a brand that you want to work with, a lot of these order forms are available online. Like there is a brand that I work with on a regular basis. Whenever I want to order that, I go to their website and pull that particular order form because it does change. And then I will take that or send it with my patient to say, I want this specific one to be measured.
And I see Sandra had put in the comments that she found the wrap working better because she doesn't have strength in her hands. And she ordered some from her Amazon on her own and now going through a therapist and now going on the what the doctor ordered. And that's a great way to do it too, is start somewhere. I know we've talked about it before with myself that I was having a really hard time tolerating some of the higher compression. And I just started with the leggings on Amazon. I would buy them like a size smaller, like the workout leggings that are have some compression to them. I actually reduced about 2 inches around my lower calves and like ankle area with just those because I was faithful with wearing them.
Yeah, and
So
see,
a
that
lot
is
of it
so
is just
huge.
figuring it out.
It is. And I'm going to jump off for half a second and I'm going to bring some things to show tell, okay?
Mm-hmm.
Oh yay, show and tell.
Mm-hmm.
Because okay, can you hear me now?
Yep.
All right. So I pulled a couple of my favorite Velcro wraps so you can kind of see that they're options. So this one is by Ulta Medical. They're newer to the block, but you see that hole right there? So
Hey
this makes
Bailey, maybe if you stop sharing your screen, we'll
oh,
be able to see you
haha.
bigger. There we go. That way people can see the whole.
All right, you can
Thank
see
you.
me? Okay.
Yes.
Yep.
So this is a Velcro wrap system. You put your leg in it or your limb and you just wrap the Velcro around and it holds in place. Alta Medical is like the only one that is doing this with this hole. And there's a little bit of Velcro not attached here so that when this is strapped down, all you have to do is kind of flick it and you can get it up. And then this hole, you can take a pen and pull it or the back of a wooden spoon and then also use it to strap it back down. So that's why, like, these are kind of things to start with, but there's a lot of options out there. So, yeah, if you have arthritis and it's hard to get these on, Velcro is a really fantastic tool. Um, there is another one, there's something called reduction kits, and it comes in a couple of different brands. This one is Ulta Medical because this is what I've got. But the Velcro comes off so that as you reduce, you can actually trim this Velcro down and reattach this. This is also one of the reasons that these garments only last 3 months is because the Velcro fails. It's not really designed to take a lot of abuse throughout the day. And sometimes you can have gapping in between these two different layers. And this is where you can also, again, look at different brands because Ulta is one, L&R is one, Medi is one. Just about every company that does compression daytime garments has some sort of Velcro system. And you can even play around with it. So maybe getting to your calves is a little hard in terms of trying to grip and pull compression socks on. Well, you can do a Velcro system for the lower leg, but maybe it's easier for you to pull on bike shorts. So let's get compression bike short options. Um, and kind of also on that note, this is an example of a flat knit garment. It's just, it's sewn flat and you can see these seams that are added in to give that extra support. So it's a little bit different than regular pantyhose. So this is circular knit. And if you can see, there are no seams on it because it is literally knitted as a giant tube. But you can see how much this stretches. This has very little containment compared to something like this.
Anyone have any other questions for Bailey tonight?
Okay, I do see Sandra mentioned the Koa Day Spring pump. So that's actually a really cool pump, and this is where those technologies are changing a lot because that particular pump is not billed as a traditional pump. So this is actually where you can get kind of two pumps covered. I cannot remember what it's billed as, but the Day Spring is cool because there are no cords. There's no torso piece. It's really just for like your legs, and I think they have an arm piece now. It's fairly new to the market, but it's powered by a battery pack. So you can put it on and go about your day and do other things so that you're still getting that compression pump therapy without being stuck for an hour in the chair.
Hmm, neat.
I'm trying to
All right.
see.
Yeah.
Okay, I do see a comment about the crotchless compression. And this is where you get to experiment and try what works for you and what doesn't work for you. Because, those are not things that are often talked about in some of these Facebook groups. I know there's a lot of talk about, I like this brand works really well for me. Well, it works really well for that person. It may not work for you. So you do have to take your lifestyle and your care team into consideration when you make your compression choices.
And to that note, with Francine, the disposable funnels for peeing
Oh,
are sometimes very handy because if you are have a lot of compression on, and I found a pack of like 150 for $10 on Amazon. And I knew it's like, this is going to be very difficult. And the amount of undressing I will have to do to go to the bathroom didn't feel like it was worth it. So rather than restricting fluids like I normally would, I got those little funnels and oh, game changer.
nice.
Yeah, those can be really good. And you can also look at disposable, or not disposable, they are camping cups. They are
Mhm.
silicone and collapsible. Those are really good too to store in your bag and do things. We actually recommend all of our reduction surgery patients to get them beforehand because bathroom trips are they're a journey. But those are really good too, just to have on hand if you're thinking that getting that compression on and off is really difficult, but you want the abdominal compression. Thigh highs tend to slide down, so when we're looking at something bilateral like lipedema that affects both legs, thigh highs don't always work because they roll down, you're constantly picking at them, and that's why we usually recommend the waist high.
All right. Bailey, it's 8 o'clock. This was great. This was our very first ALA webinar for members. So, yay. Thank you.
Yay.
That was great. I learned a lot tonight, and I
Oh,
hope you all
good.
got something out of it. And I appreciate and thank you all for being here, and thank Bailey for sharing her knowledge.
Cool.
That was great.
Yeah, thanks so much
And
for joining us.
all right, if you have any questions, you always can reach out to Bailey, or you can always reach the American Lipedema Association contacting us through our webpage, AmericanLipedemaAssociation.org.